Hello, and welcome to the NSGC Industry Special Interest Group Educational Webinar Series. This section is called What's Marketing? Today I'll be presenting with a group of speakers. We will each introduce ourselves as we share our information. As a disclaimer, the views expressed in this webinar are our own personal views and are not representative of any of our companies, past or present. There are speakers groups. My name is Carol Brooks. I'm a genetic counselor with nearly 15 years of experience, mostly in non-direct patient care. I have worked for laboratories, nonprofit organizations, as well as pharmaceutical companies. So let's dive into the learning objectives. Our objectives for today are to understand basic marketing concepts, as well as possible roles for genetic counselors in marketing. Objective 2 is to examine new and transferable skills that are valued in various marketing roles via case studies. And number 3, we hope to excite you to create a personalized plan to continue to learn and uncover career opportunities within marketing if you're interested. So let's dive into that first objective about understanding basic marketing concepts. As we often do in medical education, we'll start with a case review. And the case review is my personal journey of careers and opportunities within marketing. As I mentioned earlier, most of my career has been in non-direct patient care. And I started with a genetic testing company early on in my career, where my primary role was healthcare education. During this role, I was given the opportunity to be part of many projects, and some I was voluntold to do, and some I volunteered to do. But I found that I had the consistency of looking at projects that were focused on getting the message out to a key audience. So through these projects, I worked cross-departmentally and was really in the weeds of doing medical writing, sales training, and working with patients as well. There came a time when I made a transition to a nonprofit role. And in this role, I was my primary role was fundraising, but I was part of the senior leadership team, and I was overseeing the marketing department. In that group, I had 3 staff members, one who had a specialty in grassroots marketing, another who worked in social media, and then another who worked in public relations. I also worked with my national office, who had career professionals who had been in marketing communications for decades, as well as a board of directors who had many professionals. And during this time, I got to do a lot of just-in-time learning. I was definitely not the subject matter expert. I was learning from my staff. I was learning from the board. And I was taking on projects such as media buys and developing social media content and getting the information I needed to coach my staff to be really successful. And then I made a job transition to my first real job in marketing, the first time that I ever had a title that had marketing in it. It was a product manager at a diagnostic laboratory focusing on hereditary cancer. And it was the first time that I worked in a marketing department and first time that marketing was in my title. And this, I really got to play the strategic role of understanding where my product line sat in the competitive landscape, and then really developing the strategy for the development of that product, including launches and preparing for collateral brochures or educational material, and then thinking how to steward that product through the lifestyle so it continued to grow and really met the needs of our customers. Throughout my entire journey, I really found that my path was not a straight up the stairwell, but more of a winding path throughout the woods. And that's really my take home from this, is that sometimes you don't start exactly where you think you're going to start and end where you end. But if you, through the process, look around and see what you're really interested in, what you're successful at, you can see if marketing or marketing projects are right for you. Throughout this entire journey, I discovered a couple of key skills for marketing, and a lot of them relate back to genetic counselors in general. So on this next slide, we highlight a couple of them, but to break it down, it really falls into 2 areas. So communication. As genetic counselors, we spend a lot of time learning about rapport building and active listening and interviewing skills. And this is so important when you're working in cross-communication, cross-functional teams. There's also work that we do as genetic counselors about presentations and distilling complex medical information to the right audience. Such an important part of my roles as marketing, whether it was tactical or was managing people or was on the strategic side. And the other angle, in addition to communication, is really that attention to detail that comes in. As genetic counselors, we're often looking at complex family histories. We have to be getting detailed information about medical information. And that is so important when you're managing a project, or when you're thinking about what the role of your product could be as you're developing a marketing plan. So hopefully you found my journey interesting and helpful as you're thinking about marketing ideas. And I'm going to turn it over to Calvin, who will dive into some of the more specific details about key concepts in marketing.
Thank you, Carol. Hi, everyone. My name is Calvin Chan. While my background is in genetic counseling, I have found a focus working and consulting in marketing, analytics, and product development for diagnostic and medical device industries. Let's start with the definition of marketing. Marketing can be broadly defined as activities that impact supply and demand within a market. So for example, a marketer may use an appealing brand message to increase the demand or request for a health service. At other times, a marketer may work with suppliers to optimize processes and production time. Either way, a marketer is using all their available tools and skills to ensure an offering that they represent has the desired value and outcome. As you may have noticed, the definition of marketing can be extremely broad, and as a result, you may experience a wide range of interpretations of what marketing means to each organization. What I will describe to you in this slide is a fairly common and well-recognized model called the marketing mix. The marketing mix refers to a range of decisions, actions, or tactics to consider in a marketing plan, similar to the ingredients in a recipe. As the marketing mix evolved over time, different variations have been developed, and some suggest that there are 4, 7, and sometimes even 8 areas, or P's, the initials of these, in the mix. The bubbles with the stars that you see here are the original 4 P's. As an introduction, I will walk through these P's on a high level. However, to truly understand the depth of each, it would require a discussion in itself. So the product is a technical side of what you offer, which entails the quality. Promotion is what draws people to the product, such as advertisements. Place is a channel or where the information about your product is learned. Price is the perceived and actual financial commitment of the offering. People is the internal team's connection to the customer, so the relationship. Process is a system that supports the product. And finally, the physical/positioning, that's the influence through description, evidence, or the environment that you have delivered to the customer. Ultimately, these P initials make up the framework of many marketing strategies and may be broken down differently in different industries or verticals. For example, pricing strategies for a company that sells direct to consumer is perhaps more concerned about the sticker price like you would in a retail store. Whereas pricing strategy for a lab marketing to a diagnostic test to a doctor is perhaps more concerned about communicating patient responsibility and having contracts with insurance companies or hospitals. Now that you're thinking like a marketer, let's explore typical marketing tasks one may be involved in. Many organizations separate marketing into upstream and downstream activities, which roughly corresponds to the life cycle of a product from conception to retirement. A marketing team focused on upstream marketing activities would spend their time analyzing the market to determine what people want and how to make this potential product successful, then iterating it in development with team members like researchers and engineers. Before they pass it off to the downstream marketing team, they would ensure the product is ready for selling by having all the preparations completed, including a go-to-market plan, which we will describe in more detail later. The downstream activities are what most of us interface with on a day-to-day basis. When you see advertisement, it is part of their promotions plan to get you to learn and buy it, right? The relationship with customers doesn't stop at just buying, though. The downstream team must also consider how to support the customer's overall experience and improve the product or any of the P's that we mentioned earlier, so the customers want to keep buying and even tell their friends about it afterwards. So that's kind of how we separate upstream and downstream activities. While this is illustrated as a linear process, the upstream and downstream marketing structure is more of a cycle where feedback is brought back to the upstream team to build better features or products afterwards. In the next couple slides, I'll dive deeper into common marketing terminologies and techniques, specifically the examples at the bottom of each column on this table. Let's start with the upstream marketing elements, starting with the SWOT analysis. So the SWOT analysis is a strategic planning tool to identify and analyze a project, product, and/or business. So in SWOT, right, the S and the W stands for strengths and weaknesses, and they're the internal factors in the analysis. This is similar to when you ask yourself introspective questions like, are you good or bad at math? Especially relative to others, right? And so you would jot that down, whether it'd be a strength or a weakness. O and T stand for opportunities and threats, which are the parallel questions you assess from an external perspective. This is similar to asking whether math is important in the world. Overall, the SWOT analysis is an important element of the strategic plan, and the insight you glean from this analysis can help determine which products your company should ultimately make and/or sell. And GCs are great contributors to the SWOT analysis because their real-world clinical experience can provide insight and perspective that marketers may not inherently know without research. As with any analysis, the product is only as good as its input, so missing any critical details could affect the outcome of the SWOT. That is why a GC's natural attention to detail can be such a strength in this process. Market research helps businesses make well-informed decisions, essentially taking the guesswork out with the use of a systematic approach in uncovering data and reaching a statistically significant answer. This is surprisingly similar to research that GCs learn and experience during training and work, with the exception that it is driven by a more specific business goal. This is why a GC's research experience and the skills that they acquired is extremely portable to this task. And because of a GC's sensitivity to interacting, listening, and reading people, GCs find themselves as great moderators, which are professionals trained in conducting, managing, and analyzing a focus group session. The Go-To Marketing Plan, the GTM, is part of the marketing plan that addresses how a new offering will reach the targeted audience, and to ensure that message also sticks to that customer in light of the existing competition. This GTM typically will look similar to a business plan, and is often associated with product launches and will entail carefully planned and scheduled sequence of events designed to make a big happening out of the release. This in turn would generate as much sales and recognition as possible in a very short amount of time. So a good structure to the go-to marketing plan goes a really long way. And a good place to start is actually looking at the right-hand side image for some inspirations on things that a marketing team may consider as part of that go-to market plan. Note that now we are in the downstream portion of the marketing discussion. So the sales and marketing funnel is actually a framework outlining each buying stage that a customer goes through from the time that they are aware of your existence to the decision point in finally making a transaction. In between, there may be various levels of nurturing and engagement like education, evaluating competition, and even negotiation. So for example, when you see a health system providing free educational resources online or in print, this is one of the buying stages, so you develop trust of that health system. A detailed sales and marketing funnel may also include the buying stages after the customer decides to purchase. So for example, the next stage may be to develop loyalty. And so what you'd want is for them to come back and tell a friend about this product or organization. Or perhaps you'd lead them down the road of cross-selling, which means to offer the customer a related product or service in addition to what they had purchased before. So this overall framework, especially the details and definition of each stage, is often unique to a business. So a GC's ability to quickly learn about their customers' buying journey can directly improve and refine this funnel for the organization. Part of developing that loyalty I referenced earlier is to ensure that your customers have a great experience during and after a purchase. Leaving a strong impression builds value into your brand overall and ultimately leads to a customer staying with the business longer and possibly, as I said earlier, recommend to a colleague. So for example, a provider's preference for let's say a genetic testing lab may depend if there is someone credible at the lab that they can easily reach for questions or other needs. Or another example, it depends on how easy the overall testing ordering process is for the provider. For example, we probably not want them to jump through multiple hoops and have to waste their precious clinic time to get a test across. So these are the needs that a GC would understand better than anyone else and can then design a system that caters to these potential concerns. Finally, there is the process of quantifying outcome or change of your marketing efforts. Measuring outcome is a critical piece. Not only will this be important to demonstrate success for your bosses, stakeholders, or colleagues, it is also very valuable for the marketing department to understand if they need to modify their approach. Many marketing initiatives require an iterative approach and is an experimentation to find the best fit from a cost-benefit perspective. This is why return on investment, ROI, is a fundamental measurement of marketing success. However, there are other key performance indicators, sometimes indirect, that can be indicative of success. So conversion rates is an example. Conversion rate is the percentage of potential customers that complete a specific task that you want them to do. Let's say request a demo on your website, for example. When it comes to experimentation and quantitative analysis, there are few professions as adept as genetic counselors. All the individual marketing activities that I discussed in detail fall in the spectrum from upstream to downstream marketing. Hopefully, this overview has provided you with a general idea of what marketing groups may be thinking, saying in regards to terminology, and doing on a day-to-day basis.
Thank you, Calvin. My name is Kenny Wong, and after spending 4 years in clinical counseling, I've spent the last 8 years in sales, medical affairs, training, and product management for a commercial laboratory. So we'll now move on to the second section of talking about how we can examine new and transferable skills that are valued in various marketing roles via case studies. So what have GCs done in marketing previously? From the PSS survey and also other publications, we know that many genetic counselors have had roles in product management where they're basically the CEO of the product, where they're responsible for the strategy, product roadmap, and also the product specifications as well. We've also seen genetic counselors that were focused more on provider marketing, where they're responsible for the development and execution of strategy to grow the respective products, services for providers, and really developing the right message for that group of customers. And of course, we also have genetic counselors that focus not on the providers, but on the patient section as well, where it's very similar, where they're trying to develop and execute on the strategy to grow, same thing, the products and services targeted towards the patients. And last but not least, we'll also have genetic counselors who were brand managers as well, where they're really trying to ensure the brand is consistent across all the products and services within a given company as well. Now, for technical content marketers, there are many skills that genetic counselors have that is very transferable, just because when you're developing the content, you really, first of all, trying to assess all this complex information, and then trying to distill that into a way that is easily interpretable by your customer. And so you're trying to create and distribute these audience-focused materials, and the end goal is to increase customer acquisition and retention. And you really want to ensure that integrates with the long-term strategy to build a strong relationship with customers and thought leadership and community through pull and push marketing efforts as well. So basically, you're similar to what we have learned in genetic counseling, we're trying to assess all this complex information and then think of a way that we could deliver this in an easily interpretable manner. like I mentioned in the previous slide, one of the responsibilities is to develop the product strategy and roadmap. And this is one of the skill sets that you can apply as a genetic counselor, where you're really trying to assess, based on the complex information, how do we actually tie that back into a roadmap that will be applicable for your customers. And also, a lot of the times when you have built a strategy, you really want to ensure that all the stakeholders internally are sold on the reasons, and you really need to sell the conviction of this product strategy to the different departments as well to ensure the success of your product. And so a lot of the times you are really trying to distill this complex information and effectively give a presentation on sort of the genetics side of this, and also why this would benefit the customers. In many cases, it's the physicians and the patients as well. And also, as you're selling this strategy, you're also employing active listening and interviewing skills to assess their feedback and then to incorporate that back into your overall strategy as well. And I think last but not least, one of the things that we've also learned in genetic counseling, especially when you're seeing patients, is juggling many responsibilities and basically just trying to prioritize, ensure that you're able to execute your responsibilities in an efficient manner.
My name is Elizabeth Ulm, and I have a shared position in a clinical and a laboratory role. And I'm going to talk about some transferable skills that clinical genetic counselors have that they can apply in a marketing setting. So there's substantial overlap between marketing and education. And clinical genetic counselors routinely market genetic testing options and services to a number of different groups, including patients, employers, and also providers. So when thinking about providing marketing or education to patients, genetic counselors routinely provide education about the technical differences between multiple tests or the benefits and limitations of different testing options, all to promote informed decision-making. In the same way, genetic counselors market their own services and advocate for their value at the institutional level, especially when investigating or looking at new roles within their institution, where they have to do a lot of advertising about what skills they have and how they can be applied to other areas in the hospital. And then finally, genetic counselors also must market and provide education to providers. They have to maintain an understanding of current genetic testing options and be proactive in learning about new options by interfacing with laboratory representatives. And then they have to routinely provide education about and present improved testing options to their clinical team to ensure that genetic testing ordering practices remain current, clinically sensitive, and cost-effective. In the same way, genetic counselors also have a strong involvement in patient advocacy, and this comes with a skill set that can be applied in a marketing setting. And some of these roles are dependent on the specific role and the company definition, and they may be at the organizational level, but there's still some areas for genetic counselors to connect with patients one-on-one. So some examples of this are working with nonprofit organizations to understand their needs and market a product or a company, developing or modifying sponsorship agreements in line with company policy and local laws, and advocating for changes at the federal and state level to better support patients. And then finally, developing patient advocates who can speak on key topics while also sharing their own personal stories. Now, some of these roles fill some of our ABGC competencies, so some of those are applicable here. And some examples of that include advocating for individuals, families, communities, and the genetic counseling profession as a whole, being able to employ active listening and interviewing skills to identify, assess, and respond to concerns, giving effective presentations on genetics, genomics, and genetic counseling issues, and overall acting in accordance with the ethical, legal, and philosophical principles and values of the genetic counseling profession and institutional policies.
Hi, this is Chinmay Nagaraj. I have been primarily working as a laboratory genetic counselor for the last 5 years. I will talk about the genetic counseling skills that translate to marketing skills in a laboratory setting. Some examples listed here are developing educational and reporting materials targeted towards clinicians from different specialties, helping the lab recognize clinical market needs for new test launches, representing the lab at national meetings and building professional relationships with clients, and maintaining the professional responsibility of appropriate patient care whilst keeping the company's vision in mind. All these are extrapolations of the ACGC core competencies and encompasses all the different domains of the competencies. They basically utilize a genetic counselor's ability to critically assess the genetic and medical literature and effectively communicate such information to a wide range of clients, including clinical specialists and patients, employ active listening and interviewing skills to recognize the client's needs, demonstrate a self-reflective, evidence-based approach, and act in accordance with ethical, legal, philosophical values of the profession as well as the organization. Moving on to our last learning objective, which is creating a plan to continue to learn and uncover career opportunities within marketing. We will present some resources and contacts in the next slides that you might find useful. The Practical Genetic Counseling for the Laboratory book has a chapter on genetic counseling roles in sales and marketing in the lab setting, which might be a good resource for counselors who are specifically starting a new role or are already working in a marketing related lab position. Apart from this, you can use basic marketing books to familiarize yourself with the concepts and terminologies you might need to know. If you're trying to assess whether a marketing role or a role that involves some aspect of it is a good fit for you, the Area of Destiny exercise is a good one to use. You can identify your skills, your interests, and the opportunities available and observe where they overlap. Finally, feel free to reach to your peers, mentors, and people outside of your network and ask them about their roles, how they grew into it, and what resources they utilized to improve their knowledge and skills. Here are some contacts for you to start with. We have listed GCs from multiple areas of marketing, which includes all our speakers as well. We would be happy to hear from you, share resources, and direct you to other GCs who have experience in these areas. Thank you.